56-year-old male who had recently traveled internationally, in this case to Iran. We now have 34 Florida cases, 31 Florida residents, 3 non-residents, 26 were diagnosed in Florida, 5 Florida residents were diagnosed and isolated in another state, 3 non-Florida residents have been diagnosed and isolated in Florida. We have had 2 fatalities due to COVID-19 thus far. 14 Florida counties now have a patient who's tested positive. The total number for Florida Department of Health figures, we have 151 tests currently pending results. 392 tests have come back negative. 963 people have been fully monitored to date, and 324 are currently being monitored by the county health departments. So our approach for my administration to combat the spread of COVID-19 in Florida has 5 primary areas of focus. The first is to protect the vulnerable. We have a virus, and this is a new virus. People are learning more about it every day, but the data is overwhelming that for those who are elderly or have serious underlying medical conditions, this is a virus that could be much more significant for you than for people who may be in younger age groups or have a healthier profile. And so this is a population that we certainly want to work hard to protect. This morning, Mayor Gimenez directed the temporary closure of certain senior facilities and daycare, and I applaud him for his decisiveness. I think that was the right thing to do. Yesterday, I directed Florida Department of Emergency Management to temporarily prohibit individuals who have risk of carrying COVID-19 from visiting nursing homes, assisted living facilities, adult family care homes, long-term facilities, and adult group homes. I mean, this is a time to be restricting access to facilities that house those who are most vulnerable in COVID-19. The cases in Florida have and will continue to disproportionately affect our elderly population, including those with underlying conditions. The 2 fatalities both were elderly, but both had underlying medical conditions. If you look at the profiles of the folks who have tested positive in Florida, it's been overwhelmingly people who are in their 50s, 60s, 70s. Now, I think part of that is because some of the younger folks don't necessarily develop as serious symptoms, and they may not present to be able to have. But we also know that the hospitalization is overwhelmingly with those who are elderly and frail. Second thing we have to do is increase our testing capabilities in the state of Florida. We had initially been thinking we were going to be in receipt of tests from Health and Human Services. Obviously, that test proved problematic, so they had to reissue those. But I've directed Director Jared Moskowitz with our Emergency Operations Center to purchase 2,500 commercially available testing kits. So we're receiving those this weekend, and the testing kits will give qualified labs throughout the state the process or the capacity to process tests for up to 625,000 individuals. I directed our Surgeon General, Dr. Scott Rifkes, to strategically distribute these testing kits to 50 CLIA-certified labs throughout the state, starting with hospitals so that testing can be completed closer to the patient. And Jackson Memorial will be one of the first hospitals to receive the kits. There's a concern when people present in a hospital. If you send it to the health department, that could take 24 to 48 hours. The CDC takes 3 to 5 days. The private capacity, which potentially is going to be robust, is not going to be as quick a turnaround. And so if they're able to do that in their own labs in the hospitals, the turnaround time could be quicker, and they will be able to make better use of their resources here in these healthcare facilities. Now, there's an important qualification. These kits are kits that do not include sample collection and swab materials. So they perform the testing of the sample. Now, we wanted to, at the Department of Emergency Management, also purchase swab materials and sample collection materials. There's a nationwide shortage of that right now. Now, many of the labs throughout the state do have some supply of these, but our capacity to reach the total amount that our testing kits will allow is really dependent on how much of the materials are available or can be brought into the state where you can actually extract the sample. And so we're working with the different facilities around to see what that capacity is, and then as soon as there's an ability to procure more of that, we have a standing order with the Department of Emergency Management to go ahead and procure that. In the meantime, though, these testing kits will help many hospitals and labs that do have the swabs on hand. And so I know that speaking with the leadership here, that's something that will make a difference for them. The third thing we need to do is increase social distancing measures. Yesterday, I directed the Corrections Secretary Inch to suspend visitation at state prisons for 30 days. Inmates will continue to have access to mail, phone calls, and video visitation, and legal visits will not be impacted. Today, I'm suspending all official travel for state employees. The suspension will initially be for 30 days. I also am directing state agencies to maximize remote working and telecommuting. The state has a workforce of over 90,000 individuals whose health and well-being are a priority, and if they can perform functions at home, now's a good time to do that. Further, based on the recommendations of our health officials here in the state of Florida, I am recommending to local municipalities and private entities to strongly consider limiting or postponing mass gatherings in the state of Florida. I was in contact already today with the commissioner of the PGA Tour, the commissioner of Major League Baseball. This is an opportunity, our health officials believe, where some of these large-scale events, can be postponed and do it later. Some of the athletic contests, I recommended to the PGA if they're not allowing the fans in, they can still compete the event and put it on television. People are going to be isolated or social distancing at home. That will be helpful. But if a mass gathering is not canceled, and I don't have the authority as governor to order all mass gatherings canceled, but if it's not, you need to have organized screening measures in place. I mean, for example, before entering, an attendee should be asked if they are sick or if they've been in contact, not only from some of these foreign countries that have seen outbreaks, but places here in the state of Florida, such as the cruise ship terminals. The fourth area of focus is protecting our healthcare workers. This is something we discussed with the folks here at Jackson today. Our Department of Health and our Agency for Healthcare Administration are working overtime to ensure all medical providers are following appropriate protocols when dealing with individuals who have or may have COVID-19. We want to keep our healthcare workers safe. And we want them to be in the game. If we have somebody who is exposed and then they're doing their job and interacting with other people, you self-isolate a half a dozen, 20 healthcare workers. That makes it much more difficult for the folks here to do their jobs. The Department of Emergency Management in Florida has secured contracts for nurses to be brought in the case there's personnel shortage. And I've also directed Director Moskowitz to purchase additional personal protective equipment or PPE. Finally, we must continue to monitor international and high-risk travel. Here in Florida, we'll continue to closely monitor travel and message as effectively as we can when we find out new information. So most recently, we had initially someone in Santa Rosa County who had tested positive. The international travel involved going on a cruise on the Nile River. And so that was something that was noted, but there wasn't any type of overriding guidance about that part of the world. Then we had another individual test positive for that. Our health officials talked with the CDC, and they noticed that there were some people throughout the country who had also been on there. So the Florida Department of Health put out an advisory, and a number of people in Florida and beyond who were on Nile River cruises recently presented with symptoms. And so now, of all of Florida's cases, 10 of those cases are connected to the Nile River. So that's over 33% of the cases in the state of Florida. So it's important that we, remain vigilant here in the state of Florida. I think taking proactive measures will help us flatten the curve of this. As people get exposed, there's a lag in terms of when they present symptoms. And so we're obviously conscious about the individuals who may be impacted by this directly. We also understand that if more and more people get infected this without changes in behavior or other types of changes in policy, that's going to put an enormous amount of stress on our healthcare system. And a lot of the other ailments are not going away. People are going to need medical care in a variety of different contexts unrelated to this virus. So please continue to visit the Florida Department of Health's website for the most up-to-date information and guidance, floridahealth.gov. I want to thank the mayor. I want to thank Carlos Magoya. I want to thank our Lieutenant Governor for their work and Secretary Mayhew. We'll hear from a few other folks here, and then we'll all be happy to take some questions. So I'll introduce right now our Lieutenant Governor.
Good afternoon. Thank you, Governor, again for your leadership on this very important issue that our state is facing. Thank you, Mayor, the rest of the elected officials that are here with us, our Secretary, Agency for Healthcare Administration. I'm going to share what the Governor just said in Spanish. Buenos días, muchas gracias por estar aquí con nosotros. Anoche el Departamento de Salud anunció 6 casos adicionales de COVID-19 aquí en la Florida.
And you see our Lieutenant Governor there giving remarks in Spanish regarding the very latest when it comes to the state of Florida and the coronavirus. Governor DeSantis, the big message here was that we all need to be proactive regarding the virus. A big message on social distancing as far as events being canceled down here in South Florida. We mentioned several of them at the beginning of the show where there are mass gatherings. They are thinking at this point it's best to stay home. You'll also notice Miami-Dade Mayor Carlos Gimenez is there as well. The social gatherings we talked about here on 6 in the Mix, that entire list, all the information you need is on our website at NBC6.com. The big takeaways, he mentioned several steps. Here are a few of them. The concern right now with the state is to protect the most vulnerable, and that includes the elderly. People in their 50s, 60s, and 70s tend to be those who are testing positive to the corona. There are also more of them being tested. Also, there is a plan to increase testing capabilities. We know that 2,500 testing kits have been purchased by our state, which will enable 625,000 people to get tested. As far as facilities down here in South Florida, we do know that Jackson Memorial Hospital is going to be one of the first to get those kits. And we showed you a episode from Dr. Oz when it comes to social distancing, and this is another one of the big steps that the governor mentioned. Keep social distance in mind, limit hugging, limit shaking hands, and when it comes to those gatherings, it may be best, if they have not been canceled yet, to perhaps just stay home. We're going to have much more on the coronavirus as new information does come in as far as how our area is affected, and more entertainment news right here on 6 in the Mix. We'll be right back.
Cualquier persona que muestre o presente signos o síntomas de una infección respiratoria está prohibido visitar. Cualquier persona que tenga o puede haber estado en contacto cercano con una persona infectada con COVID-19, también prohibido visitar durante 14 días desde su interacción con la persona infectada. Cualquier persona que ha viajado internacionalmente es prohibido visitar durante 14 días desde su regreso a los Estados Unidos. Cualquier persona que viaje en un crucero, prohibido visitar durante 14 días desde su regreso. Cualquier persona que haya estado en una comunidad con difusión comunitaria confirmada es prohibido visitar durante 14 días después de salir de esa comunidad. Y finalmente, cualquier persona que reside en una comunidad con contagio comunitario confirmada es prohibido visitar estos centros de ancianos. De nuevo, el gobernador reiteró que estamos muy preocupados con las personas de tercera edad. Es la persona más vulnerable y queremos tomar todas las medidas importantes para proteger esas personas de tercera edad. Los casos en la Florida han afectado y continuarán afectando desproporcionadamente a nuestros ancianos y por eso estamos tomando estas medidas, particularmente aquellos que tienen aflicciones médicas subyacentes. Esta orden fue necesaria e instamos al público a que tenga en cuenta a esta población mientras continuamos respondiendo al COVID-19. Segundo, debimos aumentar nuestra capacidad de pruebas y por eso nuestra administración le indicó al Director Moskowitz que compre 2.500 kits de prueba disponibles en el mercado que recibiremos este fin de semana. Los kits de prueba darán a los laboratorios calificados en todo el estado la capacidad de procesar pruebas para hasta más de 625,000 personas. Además, ordenamos a nuestro cirujano estatal, el Dr. Rifkis, distribuir estratégicamente estos kits de prueba a 50 laboratorios certificados en todo el estado, comenzando por los hospitales, para que las pruebas se puedan completar más cerca al paciente. Incluso Jackson Memorial Hospital será uno de los primeros hospitales que recibirá una parte de estos kits de diagnóstico de COVID-19. Anticipamos que muchos hospitales podrán participar en nuestro esfuerzo para obtener resultados más eficientes y continuaremos comprando kits y suministros médicos para brindar a los proveedores de atención médica en todo el estado para el mayor apoyo posible. Tercero, necesitamos aumentar las medidas de distanciamiento social. ¿Qué viene siendo eso? Ayer el gobernador ordenó al secretario Inch que suspendiera los visitantes a las prisiones estatales por 30 días. Los prisioneros continuarán teniendo acceso a sus seres queridos por correo, por llamadas telefónicas o visitas de video. Las visitas legales no serán afectadas. Hoy suspenderemos todos los viajes oficiales para empleados del Estado. La suspensión será inicialmente por 30 días. El Estado tiene una fuerza laboral de más de 90,000 personas cuya salud y bienestar es nuestra prioridad. Y además estamos recomendando que consideren instando a la cancelación de grandes eventos, desfiles o otras reuniones masivos. Si no se cancela una reunión masiva, se debe implementar medidas de detección organizados. Por ejemplo, antes de entrar se debe preguntar si están enfermos o si ha viajado desde una área de alto riesgo en los últimos 14 días. La cuarta área de enfoque es proteger a nuestros trabajadores de salud. El Departamento de Salud y la Agencia para la Administración de Atención Médica están trabajando horas extras para garantizar que todos los proveedores médicos sigan los protocolos apropiados cuando se trata de personas que tienen o pueden tener COVID-19. Es esencial para que podamos mantener a nuestros trabajadores de los sistemas de salud seguros y listos para poder continuar trabajando. Para refuerzos, el gobernador le ha pedido al director Moskowitz que asegure a las enfermeras por medios de contratos. Y finalmente, debemos continuar monitoreando los viajes internacionales y de alto riesgo. Anoche el presidente Trump suspendió los viajes desde la mayor parte de Europa para ciudadanos extranjeros, no para los ciudadanos americanos ni los residentes legales. Fue la decisión correcta y obviamente estamos monitoreando eso muy de cerca. Aquí en la Florida continuaremos monitoreando de cerca los viajes y los mantendremos informados lo mejor posible cuando descubramos información importante. Una situación actual en la Florida subraya la importancia de hacerlo. Por ejemplo, una investigación epidemiológica de uno de nuestros primeros pacientes reveló una conexión con el río Nilo en Egipto. Notificamos de inmediato a la mayor parte de individuos conectados con ese viaje al río Nilo. Y la Florida ahora tiene aproximadamente 10 o 11 casos relacionados con el Nilo. Eso es casi un tercio de los casos actuales en la Florida. Y para finalizar, de nuevo, quiero recordarle la importancia que todavía estamos en buenas condiciones aquí en la Florida. Estamos tomando todas las medidas para asegurar el bienestar de los floridanos. Y solo necesitamos seguir continuando a ser vigilantes y trabajar juntos como ves aquí hoy día. Y continúe visitando el sitio web del Departamento de Salud de la Florida para obtener información actualizada. Y ese website es www.floridahealth.gov. Y en este momento tengo el placer de reconocer de nuevo al alcalde Gimenez.
Thank you, Lieutenant Governor, and thank you for your outstanding leadership and also the cooperation that we've had in our communication with us here in Miami-Dade. I also want to recognize that we have our Chairwoman Audrey Edmondson here, Commissioner Higgins, Commissioner Bobo, Commissioner Diaz, Commissioner Levine Cava, and Commissioner Monestein. Thank you for being here. And Commissioner Commissioner Moss. All right. Miami-Dade County is an international hub for trade and tourism, so it's especially important for our community to add extra layers of protection against this virus. We want to be sure that our residents, travelers, first responders are safe and that our community is not hit hard by the COVID-19. We also want our decisions to be guided by science and not to overreact. And as you know, the Florida Department of Health has reported one positive case of a 56-year-old man in Miami-Dade, as a Miami-Dade resident. That is a travel-related case, and the gentleman is in self-isolation at home. Now, as difficult as things may seem, I want to remind everyone that 80% of those who test positive for the virus have mild cases or may not even know that they've had the virus. Another 15% are in serious condition, and about 3% become critical. Our collective focus at the local, state, and national levels has been that 18%, on protecting the most vulnerable to serious illness from COVID-19. The CDC and the World Health Organization have found that people 60 years and older and seniors with serious medical conditions such as cardiovascular disease, hypertension, diabetes, and cancer are most at risk. Those with compromised immune systems are also at risk. Because apparently healthy people can carry the virus, and we don't want to overburden our emergency rooms with people who can self-isolate at home, we are looking at smart ways that better protect our residents and first responders. Working with JMH and CEO Carlos Migoya, we're looking to shift resources to develop isolation spaces at MIA and also the Port of Miami. Those isolation areas at MIA and our seaport will be used to screen, question, and test travelers and employees who meet certain health criteria. Jackson will staff these isolation areas with registered nurses. Those spaces would also be used to monitor people who are being tested. Clinicians would decide at what point to release the patients to help them transition home to self-isolate, or if necessary, to transport them to the hospital. This is exactly the same procedure that doctors would follow if you went to the hospital for testing. This teamwork between Jackson and the county will help ensure that we have extra healthcare workers on site at the airport and the seaport. And for now, we continue to focus on senior citizens and those people of any age who have compromised immune systems. We develop protocols for our county's adult daycare centers, assisted living facilities, and nursing homes. And I'll add the governor's orders to restrict visitation at those facilities, and I think that's a very, very smart call. As you all know, this morning I issued an order that on Monday all the adult senior centers will be closed in Miami-Dade County. We will be working with those senior centers to develop the protocols if they need those services. The seniors need those services to be rendered at home, such as the feeding. We'll be working over the weekend to make sure that all those seniors get the services that they normally would get at these centers, at home. Deputy Mayor Maurice Kemp has been leading the development of these protocols with executives from senior service organizations and our state and federal partners. I issued an emergency order that takes effect today, which, among other things, grants the mayor of Miami-Dade County authority to order closing large events in the interest of cutting short the spread of the virus and getting our airport and seaport back to growing jobs. MIA and Port Miami currently remain in full operation. Earlier today, I met with my senior staff. I have ordered the postponement of large events such as the Youth Fair, the Miami Open Tennis Tournament, Take Your Kids to Work Day, the 5K run at MIA, and all events at American Airlines Arena. This is not just an exclusive list. We will be adding to this list as time and days go by. The March 22nd race at Homestead Speedway will be postponed. NASCAR will make the decision whether to hold the race without fans. We will be reviewing whether to postpone other large events. We're working to suspend evictions. We want to thank the Commission Chairwoman Audrey Edmondson for her support and the board's collaboration to protect our residents from the health threat. We will continue working together at the local, state, and federal levels to ensure that we meet the challenges of COVID head on. And just before we walked in, I talked to the governor. I know that the president suspended all flights from Europe yesterday, and I'm asking him for our help to see if we can suspend the flights from Cuba. I know that there's COVID-19 in Cuba. I do not believe that there's only 3. I believe there's probably a heck of a lot more, and it poses a risk to the people of Miami-Dade County and our state. And so, Governor, I know that you're in agreement, so hopefully we can get that done, and the president can add Cuba to the list of countries that we will not be traveling to and from. Life is going to be a little different for all of us in the weeks ahead. So I urge everyone to be patient as we adjust to these temporary changes to ensure the health and well-being of everyone in Miami-Dade County. And again, we're really focusing on protecting our most vulnerable, our senior citizens, and also those with underlying health issues that make them more vulnerable to this disease. And so that's where our focus is going to be on. And again, I can't say enough about the leadership of the governor and the lieutenant governor in this effort. Now I'm going to say a couple of words in Spanish. Buenos días. Como muchos ya saben, el Departamento de Salud de la Florida ha reportado el primer caso positivo de COVID-19 en el condado de Miami-Dade. Es un residente de Miami-Dade de 56 años y había viajado al extranjero. El hombre está aislado en su casa. Ahora, aunque todo parece complicado, quiero recordarles que el 80% de los casos de COVID-19 no son serios. Otros 15% son personas que tienen síntomas más graves y el 3% son casos críticos. Nuestro enfoque a nivel local, estatal y nacional ha sido en esos 18%. La CDC y la Organización Mundial de la Salud han encontrado que las personas mayores de 60 años y esos de cualquier edad con problemas de circulación, hipertensión, diabetes y cáncer están en mayor riesgo. No queremos que nuestros salones de emergencia estén sobrecargadas con personas que pueden aislarse en su casa, y por eso estamos buscando otras vías para proteger a nuestros residentes. El condado está trabajando con Carlos Migoyas, el presidente del Hospital Jackson, para desarrollar espacios de aislamiento en el aeropuerto internacional de Miami y también en el puerto. De esa manera mantenemos nuestros hospitales con más espacio para tratar a las personas de que de verdad necesitan ir al salón de emergencia. Estas áreas de aislamiento en MIA, en nuestro puerto, se utilizarán para chequear los viajeros por síntomas del virus. El personal de Jackson estaría al cargo de estas áreas de aislamiento con enfermeras registradas. De ahí ellos van a determinar si el paciente puede ir a su casa o si no, tiene que estar aislado por 14 días o si es necesario, transportarlos al hospital. También hoy tiene efecto una orden de emergencia que firmé anoche. Esa orden, entre otras cosas, le da al alcalde del condado de Miami-Dade la autoridad para ordenar el cierre de grandes eventos. Esta mañana decidí posponer por ahora grandes eventos como el Youth Fair, la carrera NASCAR de Homestead, el torneo de tenis Miami Open y todos los eventos en la arena americana de la American Airlines Arena, entre otros. Voy a seguir al tanto de la situación y seguir las recomendaciones de los oficiales de salud para decidir si posponer más eventos en el futuro. Vamos a tener más notificaciones sobre eso en las próximas horas y también los próximos días. Muchas gracias. And now Secretary Mary Mayhem will talk about the state's efforts to protect the elderly from COVID-19. Thank you.
Thank you. I want to express my appreciation for Governor DeSantis, Lieutenant Governor Gimenez, Surgeon General Rifkes for their incredible leadership at the state. I want to commend the elected local leaders here, your healthcare leaders, for their aggressive actions. Prevention is containment. And I want to express my appreciation for those who are on the front lines, our healthcare workers, those who are caring for our elderly, our EMS. We need their day-to-day dedication and support. I have had the opportunity to travel around our state this week to assess the needs of healthcare providers across Florida and to hear the challenges they are confronting on the front lines. Facilities across Florida are taking every precaution to ensure the health and safety of patients and residents and to protect the welfare of their healthcare staff. We know the most effective way to protect Florida's most vulnerable residents is to prevent the infection or those with symptoms of an infection from entering the facility. The first line of defense is vigilant screening of visitors, vendors, and staff, ensuring anyone who is sick does not visit. If someone has traveled internationally or has been on a cruise, they are asked appropriate screening questions. At the facilities that I have visited this week, I've had my temperature taken and I have responded to all of these questions. No one should be exempt. Every provider I have visited has been unequivocal in their support for and implementation of screening protocols. And every facility must have the necessary tools at their disposal to keep patients and residents safe. That's why the recent emergency order requiring comprehensive screenings at long-term care facilities is so critical. This will help ensure facilities can take necessary measures to protect Florida's most vulnerable populations. And again, we know that these are individuals who are at most risk. We've seen the tragic situation in Washington State at a nursing home there. The choice is clear. Florida will and must take every step to prevent real and potentially fatal threats to our elderly and senior populations and those with underlying health conditions. The emergency order is formalizing many precautions we have already asked nursing homes, assisted living facilities, and other residential providers to take. Additionally, my agency has a laser beam focus on those who are most at risk for infection, such as Florida's seniors populations, and we remain in constant communications with Florida's skilled nursing and assisted living facilities and their statewide associations. I have spoken in conference calls with over 2,500 providers in our state. We have a clear and determined focus on ensuring the safety and well-being of hospitals, nursing homes, and assisted living facility patients and protecting the healthcare workforce caring for them. Healthcare providers are executing their infection control procedures, which they are required to maintain at all times. This is absolutely critical to emphasize. Hospitals and nursing homes plan, train, and drill on infection prevention and control protocols. These protocols are ingrained in their standard operating procedures. Our agency has taken decisive actions to visit all hospitals, nursing homes, and assisted living facilities that have had issues related to infection control and prevention. These visits allow our agency to focus our efforts on addressing the spread of COVID-19 and to ensure adherence to the infection prevention and control protocols that we expect. I appreciate all of the efforts around the state and certainly here. We will continue to be a resource to support these efforts to protect our most vulnerable. And with that, I'd like to introduce CEO Carlos Mogollon.
Thank you, Madam Secretary. Thank you all for being here at Jackson today. I'd like to thank Governor DeSantis, Lieutenant Governor Nunez, and Mayor Gimenez, and Chairwoman Edmondson, Secretary Mayhew, and all county commissioners that are here joining us today. Joining me on behalf of Jackson, we have Chief Physician Executive Dr. Peter Page and our Chief of Infection Prevention, University of Miami Professor Dr. Lillian Abbo. I want to reassure our community that Jackson Health System has solid prepared plans in place that we've been refining as we learn more about this virus. We're not starting from scratch with our preparations. Jackson has a long history of stepping up, and there's a surge of demand for health care. After the Haiti earthquake in 2010, we took in more than 200 critically injured patients and more than 50 people burned in the 2003 boiler room explosion of the SS Norway. We've also had vast experience with public health issues dealing with infectious diseases like Zika and Ebola. I cannot stress this enough, and we are ready. We are Jackson. This is what we do. Along with our partners at the University of Miami, we have experienced physician experts in every medical specialty. We have been refining our protocols for the protection of everyone who enters our hospitals, emergency rooms, and other clinical spaces, which include screening of all visitors at clinical entry points and over the phone, asking about their travel history and any symptoms they may currently be experiencing, moving suspected patients to an isolated room for further examination, having dedicated clinical staff prepared to treat patients with pending or positive test results, equipping our clinical staff with the appropriate personal protective equipment, better known as PPE, implementing restricted visitations and enhanced visitor screening at Jackson's 2 long-term care nursing homes. As we all know from hurricane season, it's important to have strong plans and also be flexible enough to each unique situation. That's what we're approaching this situation. We are in daily communication with local, state, and national leaders, as well as other healthcare providers across South Florida. The community should feel confident that they can count on us. I'd like to now add some words in Spanish. Gracias a todos por estar aquí en el Jackson hoy. Quisiera agradecer al gobernador DeSantis, a la vicegobernadora Núñez y al alcalde Gimenez, como la secretaria Mayhew y los otros comisionados que están aquí hoy, por acompañarnos. Quiero asegurarle a nuestra comunidad que el Jackson cuenta con planes de preparación sólidas que hemos estado refinando a medida que aprendemos más sobre este virus. Nuestra base para estos preparativos es bien elevada por nuestras experiencias. Jackson ha enfrentado anteriormente todo tipo de crisis médica en nuestra comunidad. Después del terremoto de Haití en el 2010, recibimos más de 200 pacientes con lesiones graves. Cuidamos a más de 50 personas quemadas en la explosión del cuarto de caldero del crucero Norway en el 2003. También tenemos una vasta experiencia en temas de salud pública tratando enfermedades infecciosas como el Zika y el Ébola. No puedo enfatizar esto lo suficiente. Estamos listos. En el Jackson somos expertos en esta materia. Junto a nuestros socios en la Universidad de Miami contamos con médicos expertos en todas las especialidades. Hemos estado refinando nuestros protocolos para la protección de todas personas que ingresan a nuestros hospitales, salas de emergencias y otros espacios clínicos que incluyen revisión de todos los visitantes en los puntos de ingreso clínico y por teléfono, preguntando sobre su historial de viajes y cualquier síntoma que puedan estar experimentando actualmente. Traslado de pacientes como sospecha del virus a una habitación aislada para un examen más detallado. Tener personal clínico dedicado y preparado a tratar pacientes con resultados de prueba positivos o pendientes. Equipar a nuestro personal clínico con el equipo de protección personal adecuado. Implementación de visitas restringidas y detección de visitantes en los 2 centros de atención de enfermería a largo plazo de Jackson, comúnmente conocidos como nursing homes. Tal como hemos aprendido de la temporada de huracanes, es importante tener planes sólidos y también ser lo suficientemente flexibles como para adaptar a cada situación única. Así es que estamos enfrentando esta situación. Estamos en comunicación diaria con líderes locales, estatales y nacionales, así como otros proveedores de atención médica en todo el sur de la Florida. La comunidad debe sentirse segura de que puede contar con nosotros en estos momentos. Thank you, and if we haven't overloaded you with your brains, cameras, and recording items with enough information, we're opening this up for any questions that you may have for any one of the speakers. Let me start with ladies first that are in here, and then we'll come to you if you don't mind.
The dates of the tests, the results, what's positive, who's being monitored, what are the dates of all those results that were given? From what did that
Governor?
Yeah, so there's testing going on at 3 state labs, Jacksonville, Miami, and Tampa. Those samples are being turned around about 24 to 48 hours, probably closer to 24 in some labs, but that will be someone will have presented with symptoms and they're tested. That test then gets turned around. In the meantime, because they are symptomatic, they are self-isolating. Some people are in a hospital if they're in poor conditions. Other people could be self-isolating at home. Of course, we are testing people throughout the state who don't necessarily have any links to any of the hot spots, but present to the hospital and have significant respiratory problems, and so those tests happen. So that's what it is. Now, how the self-monitoring works, it just depends on when people come into contact with the public health official. So we'll get information from the CDC. I mean, on the Nile River, they presented us with additional people to contact who had been on those Nile River cruises. So then public health officials, mostly in the county health departments here in Florida, they then contact these folks. And so what ended up happening after that is people said, well, yeah, I was there in late February. I am kind of coughing. I got a little bit of a temperature. Then they go in, and then there have been tests, and then a number of those tests have been positive. So it depends on when they come in contact with some of these investigations. But once anybody presents with symptoms, if there's a presumptive positive test, then all those contacts are traced, and those individuals are evaluated just like if they had come straight from Wuhan. Yes, ma'am.
What I mean, when did all this testing begin? The results that are pending, that are positive?
So if there's pending tests, those tests would have been taken almost assuredly certainly within the last 2 days, and most likely most of the tests pending right now probably were taken yesterday. And so we're looking at, again, a 24 to 48 hour. If you are, and that's why we wanted to get with the test kits that the state's purchasing to be able to have that capability at a hospital's own lab. So then if they have people that are showing up, you don't know what to necessarily do. But if you got to wait 48 hours, and then some of the private capability, although I think they're going to be able to do a lot of volume, they're not going to turn it around in less than 24 hours. In fact, we're hearing maybe up to 5 days. So that's an important thing to know. I think that if you expand testing and try to find some of the other populations who may be under the radar, that could be very useful. But in terms of someone presenting here, if they have the capability to test in their own lab and then can turn that result around quicker, one, it's going to be better for patients, but two, it's going to make it much easier for the folks here. Because if you have to wait 48 hours, and then you've got to figure out what you're going to do with those patients in the meantime, and it's tough. Yes, ma'am.
What is the message for the uninsured and the undocumented? Will they receive free testing? Will it be free if they come to the ER?
Thank you.
Because many of the communities are being scared if they're documented, they will not come to the ER. And the uninsured, they're wondering how will they pay for it.
So basically,
Spanish?
in English first or in Spanish first? Thank you. I'll let the governor do it in English. No, seriously. First of all, by law, every hospital emergency room has to take care of any patient that walks in the door, whether they can or not pay, regardless of their ability to pay. So by law, everyone has to take them and stabilize them. I can only speak for Jackson as it relates. When it comes to any illegal aliens, we do not ask people for the immigration status, nor if we find out, do we report to any agency. So from that standpoint, we're more than open to anyone that comes in the door. In Spanish,
But you will get care, but will they get the billing after?
I said if they cannot, regardless of their ability to pay, they get taken care of. If they can't afford to pay, Obviously, those are clearances that get taken care of, but by law, they have to be treated at every emergency room. En español, por ley, todos los pacientes tengan o no tengan la posibilidad de poder pagar, tienen que ser atendidos en todos los salones de emergencia de todos los hospitales, sea en Miami-Dade, como sea en el estado, como sea en la nación completa. Número dos, en la parte, cualquier residente ilegal que esté en estos momentos en Miami-Dade, puedo decir que en el Jackson, no puedo hablar por ningún otro hospital, nosotros no tomamos comunicación ninguna de su legal o no legal residencia, ni tampoco reportamos a ninguna agencia los grados de residencia que tengan esas personas. See, Doug, that's the reason why we don't want to do that. Any information that any one hospital gives at any one time, it's inaccurate information. The important thing here, the only accurate information that we have is what happens in the entire Miami-Dade County. That's why we're no longer giving that individual hospitals. We're allowing the Department of Health to give you what tests are being done at the county level and statewide, because any one of us will be imperfect information. All I can tell you is based at that time, or whatever time it is right now, we're following the protocols. The protocols have been expanded. The criteria have been expanded, and they will continue to be expanded as time goes on. And we will test any and all patients that walk in the door that meet those criteria.
Yeah, and just so, just to be, the folks present, and obviously they meet, they're tested. One of the reasons why, if we do have an expanded capacity to do some tests, we spoke with both Carlos and the mayor about about figuring out a way. And you can't just say everyone should go get a test, because one, that's not medically valid, and two, it would deplete the resources. But figuring out ways to see how this is transmitted or being carried under the surface. In other words, you have people who may be in their 20s, in their teens, even in their 30s, who don't develop very significant symptoms. And so if you think back, I mean, I could tell you, if when I was 21, if I started coughing, I just got over it. I didn't rush into the doctor's office. So if we have the capability, and I've talked to the Surgeon General about this, of trying to spot check and trying to figure out how this may be transmitted by folks who are not terribly symptomatic, I do think that would be beneficial. And so these test kits will help. Obviously, there needs to be the capacity to swab and get the samples. But if you can do that, I think that there may be. One of the things that concerns me about it is just simply, if you look at all the positive tests Florida has had, I mean, it's overwhelmingly the same demographic. I mean, you have people mostly in their 60s, mostly had done international travel. And while in some ways that's comforting because we don't necessarily have evidence of an outbreak anywhere in the state, I also think to myself, if somebody has a symptom and they're in their 60s and they've been this travel, given the messaging that's gone out, they know it's pretty serious and they need to go in. So I think they're more likely to go seek and present themselves and seek medical attention. And I wonder, some of the younger, how many are even interested in seeking the attention, given that it doesn't really affect them as negatively. And so that would be good to know. So when you're talking about the number in Miami or not, you just understand that's people that are presenting themselves, and if they present and they fit the criteria, they're going to get tested. But I think that there are probably some people out there who just aren't presenting because the symptoms are so mild.
If I may add, just to make sure you understand, listen, we all wish that science and manufacturing would move faster in this kind of environment. You got to understand that this is a brand new virus. Everybody's learning from these things. All healthcare entities throughout the world are learning every day something new about this environment. So we're working, and all the healthcare departments are working and balancing the instant messaging while taking seriously what's creating, and most important is that we do not have irrational panic. It's important to make sure that no one has irrational panic. We need to make sure we understand and take solid steps as we go forward. The testing will continue to be expanded as we learn more about where the criteria are. I am sure the governor is very interested in this. So is CMS, so is CDC. You'll see more about that. It's just one step at a time that we're working through this.
To piggyback on his question, Governor, could you respond to been publicly saying that not enough people in Florida have been tested, and that the results can't be, that they're not there's no confidence in the results because so few people have been tested in the state of Florida.
Well, I mean, I think that the positive test they should have confidence in. I mean, those go through a process, and anytime anybody tests positive, all their contacts are traced. Many of those individuals who've been in significant contact are self-isolating. Many of those people don't develop symptoms, and so if you're not symptomatic, you're not going to test positive. I mean, that's just the reality, and so that's the way the process is going. Now, the Nile River, we had an outbreak there, and we were able to put that out, and then people started to become symptomatic and then went in. But anytime anybody is tested, if they come back positive, immediately the public health folks locally will trace those contacts, and you go through the whole deal. You do the self-isolation if you've been in significant contact. So that's been done. I mean, we have the Florida health officials have either completed or in the process of monitoring I think over 1,100 people already. And so the vast majority of the people who have been tested have come back negative. And then if folks present, obviously, and there's the criteria, we want to be able to do this in a way, and providing some resources here locally, I think, can help. We want to do this in a way that can catch some of those cases that may be flying under the radar. I think that's totally legitimate. But at the same time, we're going off the medical guidance that's coming down for the Center for Disease Control. We're going off the medical guidance that's coming down from state health officials, and it's important that it be done in a scientifically sound basis. But hopefully, with the movements we're doing today, we'll be able to have wider availability. But it's still not going to be just everyone show up regardless of symptoms or regardless of contacts, because that would end up and if you're not symptomatic, then when you actually get released from self-isolation, if you were positive, they make you test negative twice before they'll release you. And so there's just a lot that goes on to this. And I think as Carlos said, this is a novel virus. They're still learning more about it every day. One of the questions I've had is, to what extent can you transmit if you haven't done symptoms, or if you're very mildly? And they don't really know. They think you have to be symptomatic, but this is all being studied right now, and obviously informs the type of response that we have.
Let me add something, okay? That regardless, we need to change our behavior, okay? Because we don't know who is positive or not positive, all right? And so regardless of the number of tests that are given or not given, et cetera, well, what we need to do now is, as a community, is change the way we greet each other, make sure we wash our hands, make sure that we don't sneeze into our hand, make sure that, we take proper precautions. And it's not just for this virus, it's also for the flu or any other contagious disease. And so it really doesn't change what we need to do, all right? And so we need to, because, we can give tests to everybody. Honestly, we can give you a test to everybody, and people that may be positive may not come up positive, because it takes a couple of days at least for the test results to come up positive. And so really the message is that, hey, we've got to take precautions. We have this virus. It's in our state. There's somebody in our county that has the virus, and that we need to protect the elderly population and people with underlying medical diseases. And the best way to do that is for us not to get sick. And the best way for us not to get sick is to take some personal responsibility, and act a little bit different. Not really much different, but act a little differently. And for government to, hey, shut down those areas where you have mass gatherings, where the spread of this virus can actually, accelerate. And so those are the steps that we're taking right now. All right?
Question about gatherings that are not under your jurisdiction, private events that involve maybe children, parents, competitions. What would you describe as a large gathering?
Well, the guidance that we got today was gatherings of over 250 people, and so again, there'll be more. I'll be issuing more orders or suggestions in the coming hours and in the coming days and weeks, depending on what happens with the situation. And so this is an evolving an evolving threat and an evolving response to that threat. And so, yeah.
Los padres tienen muchas preguntas. Tienen a sus hijos regresando a la universidad temprano, las vacaciones de primavera, pero el enfoque supuestamente es en las personas mayores de edad. Entonces, ¿cuál es el peligro real para los niños, para los jóvenes?
El peligro real para ellos personalmente es pequeño, pero si no tienen un tipo de síntoma, algo más. ¿Okay? Si es una persona joven, el peligro es pequeño, pero el peligro es que ellos pueden transmitir la enfermedad a alguien que sí es una persona de tercera edad, una persona que tiene enfermedades médicas, una condición médica, que entonces eso sí, el virus tiene un alto índice de peligro y mortalidad. Así que ese es el problema que tenemos aquí. Por eso que deseamos que nosotros tenemos que cambiar la manera en que nosotros actuamos, también tomando medidas de sentido común, tomando medidas también que puede prevenir otros tipos de enfermedades. Así que la cantidad de personas que hay aquí o no hay aquí, cuántos exámenes, de verdad no debe cambiar la manera que nosotros tenemos que actuar. Tenemos que tener una responsabilidad personal, nosotros, para protegernos a nosotros, también para proteger a las personas de tercera edad y también a las personas que tienen las condiciones médicas, que eso son las personas que estamos enfocados. Yes.
Well done. There you go.
Oh, God. ¿Qué?
Si nos puede decir en español, lo había dicho en inglés, algo que le había pedido al gobernador sobre los viajes que tienen que ver con Cuba.
Sí, hay más de 10 viajes que van todos los días del aeropuerto de Miami, que van para Cuba. Ya sabemos que el virus está en Cuba, han dicho 3 casos. Como yo no creo al gobierno cubano, y estoy seguro que hay muchos más casos en Cuba, yo le estoy pidiendo al gobernador que por favor danos una ayuda, pidiéndole al presidente que también incluya a Cuba como uno de los países que no se debe viajar entre los Estados Unidos. Y él ha dicho que sí me va a ayudar en ese puesto. Yes, Governor.
But this is the last question, guys, all right? Last question.
Sure. Right. So there's commercial testing kits. Obviously, there was the whole thing with HHS had sent out kits. Those kits were going to lead to false positives. They had to redo the test. The commercial companies, have options. So this is a verified test. So that test can be deployed here. But in order to get results, you have to have the right materials to extract the specimen and the sample. And when we acquired these tests, we tried to just get that too because we figured we don't know what people have. There's a nationwide shortage in that right now. So we're first, kind of right there. As soon as something comes online, we're going to try to get it. But we do have, most of the labs in the state have some capacity to get these samples. I don't know what the entire capacity is. We'll be in the process of figuring that out. But at least if we're getting the kits there, here, Jackson, they use their lab, and they have some capacity to collect the samples. That's going to be positive movement. And then once everyone has enough of the stuff to take the swabs and have the samples, then we would be able to exhaust all the kits that we're purchasing on the state's behalf. And then obviously anything else that HHS wants to do. But it's that component of getting the sample that is separate from the test kits. So we're happy that we have the test kits. We think that the people will be able to use them. But we're also trying to figure out, is there ways that we can fortify the stock of these other supplies so that if the labs run low on them or run out of them, then we're able to replenish it. Thanks.
Guys, this concludes the press conference. Thank you very much.
My friend? How's he doing?
He's doing fine.